Welcome to History of Retina's Leaders and Legends series. The purpose of these interviews is to capture firsthand stories from individuals with unique retinal insights of historical significance. Through these discussions, we hope to provide a fuller understanding of the evolution of both the science and practice of retina through the lens of those individuals who have actually lived it. Today, it is my distinct pleasure to be joined by Dr. Johanna Seddon, Professor and Residency Program Director in the Department of Ophthalmology and Visual Sciences at the University of Massachusetts Shen Medical School. She is also Professor of Population and Quantitative Health Sciences, Director of the Macular Degeneration Center of Excellence, and Director of the Retina Service at UMass Memorial Medical Center. Dr. Seddon's illustrious career as a clinician scientist has focused on the care of patients with retinal degenerations and dystrophies, and she has made notable contributions to shaping our understanding of how genetics, nutrition, and lifestyle factors drive the pathogenesis of age-related macular degeneration. She has also served in numerous leadership roles, including as a member of the ASRS Board of Directors, inaugural chair of the FARVO Committee on Women and Minorities, and editorial board member of the American Journal of Ophthalmology. Lastly, Dr. Seddon is a woman retina pioneer, helping to trailblaze the way for women in the field. And I couldn't be more honored to have the chance to hear more about her journey today. Great to be here with you today, Johanna.
Well, it's great to be here, Christina.
Well, as they say, let's begin at the beginning. You spent a lot of your training and the majority of your career in the Northeast. Is that where you're from originally?
No, actually, I'm from Pittsburgh, Pennsylvania. And my parents were the first generation in their families to be born in the United States. And they were from Europe. My mother was from Suwałki, Poland. My father was from West Otten, England. And they met and married in Pittsburgh, Pennsylvania. And their fathers found work in the steel mills and the coal mines in Pittsburgh. My father actually worked in the coal mines when he was 12. And then he worked at night, studied at night, and earned a high school degree, and then worked his way up to become Secretary Treasurer of the United Mine Workers of America in our local union. And he fought for the miners' rights, better pay, working conditions. And I had 3 older siblings, 3 brothers, and 2 of them were a lot older than me. And they got married young and had children right away. So I actually grew up with my nieces and nephews because they were closer in age to me. And being the youngest and the only girl, my brothers really grew up under much more difficult circumstances than I did.
It's interesting to know that you were the only daughter of 4 children, and that sort of foreshadows what would come later down the road throughout your life and career. You attended UPitt on scholarship and clearly did well there. You graduated cum laude. Were you on the pre-med track from the beginning, or was your journey towards medicine a little more winding?
Not from the very beginning. My parents and my brothers really encouraged me to reach for the stars. And then my brothers said, well, since you do so well in school, get such good grades, why don't you think about medical school? And then I became pre-med, eventually applied and was accepted into the University of Pittsburgh School of Medicine. And there were 110 students, and there were only 7 women.
What was that period like for you as a medical student, and specifically as, a woman medical student, one of a handful?
Yes. Well, we knew we were outnumbered quite a bit, and we had to toe the line more, study harder. But in the end, we were all there for the same reason, and we did just as well as the men. And I actually don't think it interfered with my education.
Tell us how you got interested in ophthalmology.
In the summers of medical school, I worked as a scrub nurse in the operating rooms, assisting on different surgical procedures, orthopedics, intestinal surgery, OBGYN, and then one day I was assigned to work with a female ophthalmologist who was doing cataract surgery. And she had this small tray and little tiny instruments. And I was like, wow, what a difference that was. She was very happy with her field and she loved her career. That sparked my interest in ophthalmology. And then during medical school and rotating through the different subspecialties, I did an informal survey of job satisfaction and interviewed internists and pediatricians, and by far the ophthalmologists were happier with their career choice compared to all the other subspecialties. So those events really convinced me to take that path.
And this period of time, Johanna, was a special one for you in many ways because you also happened to meet your husband, Ralph, during this period of time, who was at the School of Public Health. Tell us how you met.
Ralph and I met when I was at the University of Pittsburgh, and he was at the Graduate School of Public Health at Pitt. And during medical school, we dated. He was at the Johns Hopkins School of Hygiene and Public Health, getting his doctorate degree. And then we got married right after I graduated from medical school. We then moved to Boston when he was recruited to Boston University. And he and his boss actually started the Boston University School of Public Health, which up to that point did not exist. And Ralph's been very supportive of me my entire career.
So you also have an interest in public health, and you actually did pursue a Master of Science degree in epidemiology at the Harvard School of Public Health. What motivated you to take that detour?
I saw that so much more could be done in public health compared to one-on-one as a physician. So that's what led me to take that path. And I ended up being the first ophthalmologist to have received a degree in epidemiology at the Harvard School of Public Health.
So Johanna, you ended up matching for ophthalmology residency at Tufts New England Medical Center. Those are formative years. What was residency like for you?
The chair of the department there was Dr. Bernard Schwartz, and he was a glaucoma specialist. And he was unique at that time in understanding the importance of prevention. And he was very supportive of my research. And I used my epidemiology training to conduct and design a case control study of ocular hypertension when I was a resident. And this is a risk factor for glaucoma. And we went on to do the analyses using logistic regression. And that was very new back then. And this was the first application of logistic regression analysis in ophthalmology. And the paper was used as a good example of case control method in an ARVO course on statistics and epidemiology.
How did you find your way to retina?
Yes, well, during the residency, we had several rotations at the local VA hospital. And there we saw a lot of retinal pathology that reflected the systemic diseases of the patients. We were also studying the book by Weiss and Henkind. This was a classic textbook of retinal anatomy, pathology, physiology, and I think that's where my interest in retina began.
Well, after your time at Tufts, you ended up pursuing not one, but two fellowships, one in ocular pathology and another in medical and surgical retina, where you were actually the first woman fellow in the program's history at Harvard. Tell us about your thought process in pursuing these fellowships, and what were you starting to envision your career looking like?
I thought ophthalmic pathology would be a wonderful foundation for any field, and indeed it was. And I had a great experience there working with Dr. Daniel Elbert. He was a very good teacher, and we remain friends to this day. We did a lot of studies on melanoma. I counted the number of malignant epithelioid cells per high power field under the microscope, and that ended up being a risk factor for metastases. And I also did another study with him. We collaborated on a deficit survival analysis with Phil Lavin, who was a statistician at the Harvard School of Public Health. And we projected that there would be no survival difference between irradiation and enucleation for melanoma in that analysis. And then, as you said, I went on to the retina vitreous fellowship. I was the first woman in the program under the direction of Dr. Charles Regan at Mass Eye and Ear. And we did scleral dissections for retinal detachments and other retinal surgery.
Well, clearly you did an outstanding job because you ended up staying there for your first job after training. Tell us about your early career and maybe mention some of the pivotal events and people that have shaped where you are today.
Yes, early on when I became faculty at Mass Eye and Ear, I started the first epidemiology unit there. And Dr. Efren Friedman was the president and CEO of the hospital, and he was very supportive and understood the importance of prevention. And our mission was to find the causes and risk factors for eye diseases. And I initially started in the field of melanoma, and my first NIH R01 grant was a case control study of uveal melanoma, and we found Northern European ancestry, Celtic origin, number of cutaneous nevi were all associated with this disease. I then went on and started the tumor registry and designed the forms, hired and trained the staff, and we did analyses, added Kaplan-Meier survival curve analyses to this field for the first time. And we looked at factors like tumor diameter, tumor height, anterior location of the tumor, distance of the posterior edge of the tumor from the optic nerve and macula. And our outcomes were visual acuity, metastases, mortality. So we published a lot of papers on these topics. And during that time, I also designed a method for measuring sunlight exposure by doing skin biopsies. And we looked at risk factors like occupation and smoking and melanoma, essentially applying epidemiology to this disease. And that registry is still being used today.
That's amazing for your contributions to create such a foundation for all of the research that would come forward. You've contributed in so many ways to our understanding of ocular tumors and oncology, but you've spent a lot of your career studying macular degeneration, as you all already mentioned. What spurred your interest in this particular disease?
It was much more common, and it was a leading cause of blindness. And many of my patients had macular degeneration. And the only thing we knew back then was it was related to aging. And it was even called senile macular degeneration, or SMD, for several years. And my patients were asking me, like, why am I getting this disease? How do you prevent it? Why do some people progress and others don't? And are my family members at risk? And we didn't have any answers to any of those questions. So that's when I used my epidemiology background again, wrote some grants to look at risk factors for the disease, including diet and nutrition. That didn't go very well. They weren't funded. So I used some private funds and foundation funds to start a smaller version of this study in my own clinic. And that's when my longitudinal study of macular degeneration started. And around that same time, in the mid-1980s, the NIH launched the Eye Disease Case Control Study, or EDCCS. And one of the diseases under study was macular degeneration. The protocol, however, didn't have anything in it about diet nutrition. So I said, why don't we add diet nutrition to food frequency questionnaire? And they said, well, yeah, we'll look at the bloods for the nutrients. And those specimens were sent to CDC, but they weren't too keen on the diet questionnaire. And he said, well, if you want to do it, you can. And so I did. And I started the ancillary study of diet nutrition. And all 5 centers, PIs, agreed to participate and gamble sort of with me on this study. And I'm very grateful for that. And we used the modified questionnaire, food frequency questionnaire that I designed for use in elderly subjects with vision problems. And we validated that questionnaire, and all the responses came back to me. We analyzed it. And what's amazing is that whole effort led to the report of the beneficial impact between AMD and all the dietary factors of lutein and zeaxanthin, the carotenoids, the dark green leafy vegetables, spinach and kale. And some of these nutrients were associated with a reduction in risk of as much as 56%. And this was published in JAMA in 1994. And as a result, the AMA, because this was new and actionable, they invited me to the AMA Science Writers Conference to present the paper and discuss it. So that was a very exciting time. And after that, we studied other dietary factors like dietary fat and beneficial impact of omega-3 fatty acids in fish. We reported that at ARVO in 1996. That same year, we published the article on the adverse effect of cigarette smoking on progression of AMD in a longitudinal prospective study, and that was published in JAMA in 1996. And we were also measuring waist and hip ratios in the clinic, and patients were asking why, and I said, well, we know it's related to heart disease, and maybe it's related to eye disease as well. And indeed it was. Abdominal adiposity was a risk factor for macular degeneration. And we found the adverse effects of trans fats, processed foods, and the beneficial effects of nuts and exercise on AMD. So we were establishing the behavioral lifestyle factors that were risk factors or protective factors for AMD. And we knew then it wasn't just aging.
When was the NEI, when did they become interested in nutrition and how that associated with macular degeneration?
Dr. Carl Kupfer, who was director of the National Eye Institute, was interested in doing a clinical trial on nutritional supplements. He appointed Rick Ferris, who was intramural at that time, to lead the study, and the ARED study started in 1991. And Rick was aware of the work I was doing on nutrition, and he confided in me that, Johanna, I don't really know too much about nutrition, but Carl wants me to do this. But I was very happy that they did add the food frequency questionnaire to the AREDS protocols. And was also happy that smart people like Rick and Emily Chu got involved in the clinical trials, the ARED studies. And I was very pleased to see ultimately that our early results of the beneficial effect of lutein and zeaxanthin on AMD and the dark green leafy vegetables, spinach and kale, and omega-3 fatty acids in fish, they were all replicated and confirmed in the diet part of the ARED studies many years later. And we also went on later to show the beneficial impact of the Mediterranean diet, which essentially has a lot of those dietary components, in 2015, and showed that that style diet is beneficial for slowing the progression of the disease. We also looked at vitamin B9, folate, and vitamin D, and those seem to be protective too.
The other piece to this is genetics. And so moving forward here, you're now mid-career, you're recruited to Tufts Medical Center, and you got a start in genetics here that helped to blossom a whole different focal point in your career. Tell us about that transition.
Yes, well, actually, I started thinking about the genetics of AMD way before then, before there was much interest in it in the early and mid-'80s, and started to draw bloods, extracted DNAs from patients in my longitudinal cohort study. I started to enroll family members of cases in a family study, and then also conducted a twin study looking at genetics and environment. And the concept of that was that the monozygotic twins have 100% of their genes alike. The fraternal twins share about 50%. So if the disease is genetic, then the monozygotic twins should look more alike than the fraternal twins. So we had a hard time getting those grants funded, but the first time we applied, the review came back, well, there's not too much evidence this disease is genetic. And so I emphasized the behavioral factors more, and then the reviews came back, what about genetics? So after about 3 times, I got the grant funded, and many of the twins had died by then, but we did go on to show that the disease is indeed genetic. It was highly heritable. Up to 71% of the disease is heritable in the advanced stages of the disease. But that wasn't 100% genetic. Not all the MZ twins looked alike. And we used the discordant MZ twins and that knowledge in a separate study and to find out, well, why were they different? And the differences were explained by behaviors, diet, and smoking. So this is one of the first examples of epigenetics in the field of macular degeneration. Actually, all of that work was done at Mass Eye and Ear before I came to Tufts. And then when I went to Tufts, I was interested in looking for the actual genes. And we wrote a grant, got good reviews, but NEI cut the genome-wide association study for cases and controls, the GWAS, and said, well, just focus on your families. So after I went to Tufts, I was fortunate to find a donor who was interested in helping us out to find the genes, not just heritability, but to find the actual genes. Unfortunately, we missed out on the opportunity to report the first gene associated with AMD. That was in 2005. But we did go on and find another variant in that same gene, CFH, that was actually a stronger risk factor for AMD compared to the original variant that was reported. And we also, our team, multidisciplinary team, also found other genes in the complement pathway, complement component 3, C3, complement factor I, CFI, some of the lipid genes, LipC, ABCA1, extracellular collagen matrix genes, and others. So we were very productive in finding some of the genes related to AMD, including the first rare variant, which has the highest impact on AMD to date, and other rare variants in the complement pathway, CFI, C3, and a risk variant, C9. And many of these genes are being leveraged now for therapies for macular degeneration.
So after over a decade at Tufts, you were recruited to UMass because they had opened up a new macular degeneration center. You eventually became interim chair. And another title that you hold there is the residency program director. Tell us a little bit about that. What has your experience been teaching and guiding the next generation of ophthalmologists?
Yes, I was recruited to UMass, and I actually became interim chair for a couple years. And it was very enjoyable working with the faculty, solving problems. And at the same time, I was director of the Macular Degeneration Center of Excellence, doing my studies on epidemiology and genetics. And some of my patients actually followed me to UMass, and some of the study subjects too. And as you mentioned, the residency director position, I have been residency director for 2.5 years. And it's very rewarding to be involved in working with the young residents and helping to teach and mentor them. And they're very excited, eager to learn. They want more didactics, more teaching, more meetings. And it's wonderful to be involved in their education. And in some ways, we can learn as much from them as they learn from us.
One of the highlights of my presidency year at Women in Ophthalmology last year was having the opportunity to recognize you with the Scientific Contribution Award. Congratulations. And so well-deserved. You're someone that I and many others have long admired for all of the contributions that you've made as a scientist, but also because you really are a trailblazer for women in this field. And we've talked about this before, but as much as the representation of women has grown, especially over the past decade, certainly there are still some disparities that exist. And I can imagine you in your early and mid-career, there were probably very few people who look like us in your professional circles. So I wanted to just drill down a little bit more, hear your viewpoint on what that was like as a woman in the field in a very small number of people. And then maybe also what you feel is the greatest challenge that still exists for us as women in 2025.
Yes, well, when I started my career at Mass Eye and Ear, there was a senior male ophthalmologist who advised me to not be interested in committees or leadership roles and just hunker down and do my work. So, and after a few years, I was still a young faculty member, and I asked, well, how is my career going? What could I do better? And I was told, well, you're doing very well, and actually maybe too well. And I went, oh, okay. And I don't see that being a woman in the field of ophthalmology is as much of a challenge now as it was back then. You know, I was one of very few women in the medical school class, whereas now it's more than 50% are women. So I think women have a bigger voice and more representation than they used to. However, I think there is still a challenge, and that is in leadership. If you look around this country, all the chairs in ophthalmology, most of them are middle-aged men.
Well, apart from your work as a clinician scientist, you've also held several leadership roles in really our major organizations, for example, ASRS and ARVO. Tell us how you got involved with these organizations and what have you enjoyed about being such an active member?
Yes, well, ARVO was a very wonderful experience. I was on the planning committee, and then I was elected to be a trustee by our clinical and epidemiology section of ARVO. So I was on the board of trustees. I became vice president. I was on the strategic planning committee. So this was all very rewarding, educational, and I enjoyed the networking, meeting new people, establishing collaborations. And in terms of the ASRS, I've always admired the founders for their vision and courage to start the society. And I was very supportive early on. I was a member of the Vitreous Society. And then I was on the board of the ASRS, the foundation. And the meeting and the membership has exploded. And it's amazing now that the entire retina community can come to the meeting and be educated about the state-of-the-art research as well as current management of the retinal diseases.
Well, speaking of the founders, you are also the ASRS 2023 Founders Award recipient. Another big congratulations to you. You also held a board position within Winner, which is the ASRS's section dedicated to women in the field. Can you just share a little bit more about your viewpoint on watching that evolution, and what are your favorite parts about being an ASRS member?
And the ASRS Founders Award, that was an amazing tribute in honor of the founders, Jerry Bavino, Roy Levitt, Alan Verne, and how they overcame amazing obstacles to start a new society. And then now it's like the biggest retina society in the world. So it's really incredible. And I think about their career and the obstacles they overcame. And in some ways, it mirrors what I have had in my life as challenges. And like them, I succeeded in overcoming them. So.
Well, before we wrap up, I am hoping you will humor me in my little game here where we ask 5 rapid fire questions. I call this segment Quick Questions with Christina. So if you would, tell us the first thing that comes to mind. Try to keep your responses less than 30 seconds. But the first question I have for you is, what do you feel is the greatest discovery in retina?
Yeah, I would say optical coherence tomography. Yeah.
Totally agree. We actually just had a panel through the ASRS History of Retina on that, and that has really revolutionized our field. Person or mentor who's most significantly shaped your career?
Well, it's very difficult to answer that with one name, because I really didn't have one mentor. I had a lot of people who were very supportive of my career all my life, and I'm very grateful for that. I also think collaborators who you can trust and rely on are also very important, and I had several in the field of genetics. And in the last few decades, I've been working with Bernard Rosner, statistician at the Harvard School of Public Health, and we've written many grants and papers together.
How about the career accomplishment that's given you the greatest sense of satisfaction?
I was one of the first to introduce epidemiology and prevention to ophthalmology, and then I introduced nutrition and the food frequency questionnaire to the field and expanded our knowledge about AMD way beyond aging, and found many of the behavioral and lifestyle factors associated with AMD that would help establish the management of AMD worldwide. And then we expanded the knowledge about AMD genetics and expanded and identified the relative role of environment and genetics in AMD using our twin study. We found about 15 of the first genetic variants associated with AMD and identified the first rare variant associated with AMD, which has the strongest risk for AMD to date, and then went on and found other rare variants in the complement pathway as well.
How about your favorite thing to do outside of work?
Well, I really enjoy classical ballet and watching the performances at the Boston Ballet. I, many years ago, danced in the Pittsburgh Ballet when I was going to college, and we performed at the Pittsburgh Opera House, which was very close to the campus. So I still really enjoy dance, and as well as music and art.
Well, Johanna, one of my favorite parts about retina is just how dynamic this field is. We've really achieved a number of advancements over the past decade, 2 decades, in a relatively short amount of time when you really look across the whole time frame. What excites you the most about retina?
Well, it's always dynamic, and I think that we will soon have treatments that will reduce the burden of macular degeneration. There's so many clinical trials underway now. And I think we will ultimately have precision medicine too, that we will identify individuals who are most likely to benefit from certain treatments. And I think we will also be focusing more on the earlier stages of the disease to reduce the number of people who are losing vision from AMD. And we really need treatments for macular dystrophies too. And I think that will become a reality soon.
Well, Johanna, it's really been such a true privilege to hear about your story in your own words. As you know, are a role model for so many of us. It really, really is a joy to speak with you today, and we appreciate all of the contributions that you've made to retina thus far. We know there are many more to come. So again, thank you on behalf of the ASRS History of Retina Leaders and Legends for being here with us today.
Well, thank you very much.